Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, serve.
Let's journey deep into the brainstem to a structure that, despite being only an inch long, serves as a vital bridge for our entire nervous system. It's a region that is profoundly significant to our very existence. Today, we're going to explore the Pons. So, to really start our journey, let's begin with a simple question. What exactly is the brain's central bridge? Well, the answer is actually hidden in the name of the structure we're looking at today. You see, the name Pons comes from the Latin word for bridge, and that perfectly describes its most fundamental job. It forms this crucial connection, linking the medulla oblongata below it to the midbrain above it. And just as important, it connects the right and left sides of the cerebellum, which, as you know, is the brain's command center for motor control and coordination. And to give you a sense of just how compact this is, this entire vital hub is only about 1 inch, or 2.5 centimeters long. It's an incredibly dense and complex piece of neural architecture packed into a tiny space. Okay, so here's our plan for this exploration. We've done our quick introduction. Next, we'll examine its external anatomy, and then we'll journey inside to look at its internal structure. And finally, we'll look at cross-sections at 2 key levels, the lower or caudal pons and the upper or cranial pons. So first up, let's explore the external anatomy. We're going to look at the pons as if we were able to just hold it right in our hands. Here we're looking at the anterior or the front view of the pons, and right away you can notice its distinct convex shape, how it kind of bulges forward. That bulge is created by just a multitude of transverse fibers that are sweeping across its surface. And if you look really closely at the midline, you'll spot a shallow channel. That's the basilar groove, and it provides a nice protected space for the basilar artery. This front view highlights several really key landmarks. Those transverse fibers we just mentioned, they all converge on each side to form these massive middle cerebellar peduncles. That's the main connection to the cerebellum. We can also see the exact points where several cranial nerves emerge. See that large trigeminal nerve? And then, down in the groove between the pons and the medulla, we find 3 more: the abducens, the facial, and the vestibulocochlear nerve. Now, let's shift our perspective and look at the posterior, or the back surface. This is a view that's typically hidden by the cerebellum. But with the cerebellum removed, this triangular posterior surface becomes visible. As you can see, it forms the upper half of the floor of the 4th ventricle, which is a key fluid-filled space within the brain. All right, let's point out the crucial landmarks on this posterior surface. It's bordered on each side by the superior cerebellar peduncles. And near the midline, you can trace a raised area called the medial eminence. Now pay close attention to the lower end of this eminence. There's a little swelling there, known as the facial colliculus. This small bump is a really important external clue to a much more complex internal structure, which we are going to explore in just a moment. Okay, so we've examined its external features. Now it's time to journey inside. Let's peel back the surface and really explore the internal structure of this incredible neural bridge. So, internally, the pons is broadly divided into 2 main parts. The posterior part is called the tegmentum. You can think of this as the more ancient, foundational part. It contains the collections of nerve cells, the nuclei, for cranial nerves, as well as numerous ascending and descending tracts. The anterior part is the basilar part, and this section contains the pontine nuclei and the massive descending motor tracts. Now, to really understand this internal organization, we're going to examine it at 2 different levels. We'll start lower down in the caudal pons at a cross-section right through that facial colliculus we saw earlier. This cross-section does a brilliant job of illustrating the internal complexity. Remember the facial colliculus, that little bump from the outside? Well, here we can see what actually creates it. It's the fibers from the facial motor nucleus looping around the abducens nucleus. This really intricate arrangement is a defining feature of this level. You can also see prominent major sensory pathways, like the medial lemniscus, which carries information about fine touch and our sense of body position up toward the cortex. The crucial point here is just the sheer density of function. This table gives you a snapshot. At this single level, we have critical nuclei controlling facial movement, eye movement, and balance. And at the same time, you have these massive motor tracts descending from the cortex, while vital sensory tracts are ascending towards it. It is a remarkably busy intersection. Okay, let's move upward to our second cross-section. This time, we're going through the cranial, or upper part of the pons. right at the level where the trigeminal nerve emerges.
Now, the anatomy at this higher level is distinct. The most prominent features you'll notice are the large nuclei of the trigeminal nerve. You can see the main sensory nucleus located laterally and the motor nucleus more medially. Together, these are responsible for all the sensation from your face and for controlling the powerful muscles you use for chewing. Notice also how the basilar part in the front has gotten even larger, just densely packed with pontine nuclei and crisscrossing fibers.
And again, this table provides a really clear summary. We see those trigeminal nuclei and the pontine nuclei, which are absolutely critical for relaying information from the cerebral cortex to the cerebellum. The major motor and sensory tracts are still here, of course, but now they're joined by the lateral lemniscus, which is a key pathway for auditory information. So, after all that, what is the ultimate takeaway? Well, the Pons is far more than just a simple bridge. It is a dynamic and absolutely critical processing hub. It's where sensory information gets processed, where motor control for our face and eyes is orchestrated, and it's where the great command centers of the cerebrum and cerebellum connect with the rest of the body. And this really leaves us with a final and pretty profound question to consider. Within this intricate wiring, all of it packed into a space barely an inch long, are the circuits that control our sleep, our breathing, our facial expressions, and our balance. It truly makes you wonder, how does this single inch of tissue orchestrate so much of our existence?